everyone. Welcome to the Period Party. I'm Nicole.
And I'm Nat.
And on this episode, we're talking about the secrets and science of sexual desire with Dr. Anna Cabeca, an expert in women's health and functional medicine. She's an Emory University trained board-certified gynecologist and obstetrician and board-certified in anti-aging and regenerative medicine. She specializes in bioidentical hormone replacement therapy and natural alternatives for optimal aging and high performance. Dr. Cabeca's years of experience in her private practice, along with her own journey of transformation, has placed her as one of the most in-demand speakers regarding restorative health, sexual health, and anti-aging. She has literally traveled around the world to find the best natural solutions in health. Her belief is that the advantages of creating health and hormone balance not only improves our own health, but also improves the health of generations to follow. Welcome to the show, Anna. Thank you so much for joining us.
Well, thank you so much for having me.
Yes, it's a pleasure. Okay, so we're talking all about science of sexual desire. I'm really thrilled to jump into this. I feel like there's probably a bit of a story behind how you got into this work. I would love to hear a little bit more about how you got into it.
Well, I trained at Emory in OBGYN, and when I got into private practice in Southeast Georgia, I quickly entered into a solo practice, and I had a client come to me, and she had a history of ductal carcinoma in situ. At the time, she was 63 years old. This is in 1999. I just got out of residency, and she's like, "Doc, I have no sex drive. I'm dry like the desert. I, love my husband. I just don't want to have sex. And I'm a child of the 60s, and sex is very important to us. And, I'd rather die than live this way. Help me." And I was like, "Oh, sure." And I looked in my doctor's bag, and I looked, and I was like, well, what did I learn that could really help her? And DCIS, is that breast cancer or not? Or then what about testosterone replacement vaginally? I know estrogen vaginally seems to be really safe according to the research, but she was told even that she shouldn't use that. And so I dug into the research. I had done research before I went to medical school, so I love it. And I started using some vaginal androgen replacement therapy, and such as a small dose of testosterone in the vagina, and that just totally transformed her vaginal tissue, her vaginal dryness. It totally transformed her libido, and among other things. It was very essential for her overall quality of life. And seriously, 10 years now, 15 years later, doing amazing, good high integrity, still lobbying on Capitol Hill, and her bones are as good, if not better, than they were 15 years ago. So I think that's really substantial to look at, and that we're able to replenish, rejuvenate our sexual health and function no matter what. And it's such a silent issue between couples, right? If it hurts every time you have sex, why would you want to have sex?
No kidding.
So I have to joke, you ladies are so fun, and it's like, since when did a DSM-5, psychiatric illness be not wanting to have sex with your husband, right? And we call that, there's a criteria for that. It's like decreased libido, but really,
Seriously.
It's so misunderstood, and if we just get to the root causes, and there are multiple layers of that we can really transform a couple's relationship.
Wow. So, Dr. Anna, are you talking about, obviously women as they get older, this is a natural thing that happens, and certainly that's something that is relatable to, aging. But what about, are you talking about younger women this happening to as well?
Yes, absolutely, especially postpartum, and when we're on birth control pills. For many women who are on birth control pills, or even progesterone implants, whether it's IUD or in the arms, the implant-on, for example, you can have changes to the vaginal tissue, and that can cause problems. We know that birth control pills work to decrease acne because they lower testosterone. Well, that's part of our libido, our sexual drive, right? And that's often why we have cyclical increases and impulses to have a higher libido. But when we're on something that suppresses that, then we'll have the changes that go downstream with that too, and that includes vaginal discomfort that can affect us. And postpartum, Absolutely. There are many issues postpartum, maybe not so much vaginal dryness, although that can be part of it, but pain, perineal pain from an episiotomy, or even pain from a C-section scar. I mean, things like that can really cause us to withdraw from having sex as well. So to make that comparison, I always say, for example, if a baseball player goes up to bat and gets hit by the ball every time he goes up to bat, would he want to play baseball? No. And for many women, it's subliminal. It's not like we make that association, well, it hurts every time, so I don't want to have sex. It's more like, I don't want to have sex, and it may be because it hurts when I have sex, or I have a discharge after I have sex, or, an odor after I have sex. So other reasons that affect our libido versus only testosterone, which is big in the media and the lay literature.
I can totally relate to that. After having 2 children, one was vaginal, one was cesarean. There was no way in either of those cases my husband was coming anywhere near me, especially after the vaginal birth. Like, I was like, no, mate, this is shut shop. Like, I was actually, there's an element of being afraid as well, because, you have gone through something that's very major, and then you don't really know, what's going on down there. I had to have, I had stitches because I had a tear, and it is all of those things. So I love this conversation, because I guess it gets women talking and curious and understanding their bodies a little bit better. Especially, I can relate to the postpartum anyway.
Yeah. Yes, absolutely. And I had, as an obstetrician, delivered many babies, and my first baby, 8 pounds, 5 ounces, vaginally delivered, and I had an anterior tear up alongside the urethra, right? From that point on, I made sure I gave downward pressure on any head coming out of the vagina, right? That hurt for over 1.5 years. So I get that too, and it's a difference, but definitely the benefits to vaginal birth outweigh cesarean when we can have it safely, right? Mm-hmm. So a reason to have a cesarean would not be to preserve the perineum, or to decrease incontinence. None of that really weighs out, because we can use some vaginal hormone therapy and strengthen the muscles of the urethra to decrease incontinence. And that's what I really want to emphasize too. Like, as we get older, these changes, something that we can be able to help is the vaginal health, and that becomes really important and easy to correct, actually.
I can, yeah, I mean, obviously having one of each, a vaginal and cesarean, I can say the recovery from the vaginal birth was 100 times better than the cesarean. And I think, look, maybe that was because it ended up being an emergency cesarean, but in my mind, I'm like, there's a reason it's supposed to come out that way. Like, not only for the health benefits, but also for the mother and the recovery. Obviously, sometimes complications happen, and it's all these things that you're talking about. But even for me, in the long run, the cesarean, it took me well over 1 year to fully recover, I feel like, anyway. Yeah. Even just the scar itself, and yeah, it's a big deal.
Yes.
I wanted to ask about the libido issues for women who haven't had children, because that's a really big thing too. I have so many women in their 20s, and granted, many of them have been on the birth control pill, but so many of them have said something along the lines of, I'd rather be gardening than having sex.
And that's not just because they don't like their partner, right?
Right, exactly. I mean, this is women literally in their 20s and early 30s even. And I was curious about that. What makes our libido come and go, aside from being postpartum or having been on the birth control pill? Is there anything else?
Oh my gosh, yes. And I'm so glad you asked this, because it is so important. I think there are a few things. Expectations, number one, right? The media kind of says, oh, you're supposed to be on all the time, and, have your sexy on. And that's just not how we're designed, honestly, right? Mm-hmm. We're designed cyclically to be interested, and that's at the time of ovulation. So there's a handful of days a month that our hormones surge, our testosterone levels surge, and say, okay, this is the time to mate, right? Physiologically, that hasn't changed in 10,000 years, right? The media wants you to believe every day I need to be turned on. And great, be in your feminine energy, be in your, in your totally confident in your femininity and connected to that. Absolutely. But physiologically, there's, our neuroendocrine, our chemistry that addresses our physiology drives our behavior, right? So if we're stressed and which will deplete our testosterone and our DHEA, which is one of the adrenal hormones that helps us have drive, also feedback, testosterone and DHEA feedback to our dopamine, our neurotransmitter system to give us interest, right? Drive. And so when we're stressed, y'all, we just don't have that, right? We don't want to have sex. It's fight or flight or feed and breed. So when we're high stress, whether it's because we're getting text messages that are constantly drawing our attention away, and we're multitasking, and we're stressed because we watch the news, and we're stressed because we're at a stoplight and we're late for work, whatever it may be, that depletes our reproductive, our restorative, regenerative hormones. And it does make a difference. So that's one thing, media expectations. And then number two would be stress. And then and just knowing that physiology drives behavior, right? So we have to understand, I want to get my physiology balanced so that I'm in my most balanced self, especially when I'm in my 20s, because when I'm ready to have children, I want to be able to conceive and not deal with the rising rates of infertility that my friends, et cetera, are dealing with. So I think that's a really important concept. A third thing is understanding women's sexual response curve. Men are visually stimulated. They can turn on like the Autobahn, be ready in a moment, and straight to their goal, their endpoint, right? Women are like the romantic Strassen, right? Like we take our time, we're almost there, we go back, we stop and look at the goats on the hillside. I mean, our attention is distracted, right? I mean, we physiologically get distracted too, and we have a longer span, a longer curve. So if you kind of visualize a swirling road going up a mountainside versus the straight path of the Autobahn, right? That's women versus men. And we are actually secondary responders. And this is what my patients would say to me over and over again, which made me rethink the Masters and Johnson sexual response curve. It's actually not like that at all. For any of your geeks listening, Basson response curve, Basson, is quite more accurate. But really, if you play the game of Candyland, that's really the female response curve, okay? Sometimes
we've got a lot to think about. We've got a lot to do. We've got a lot to think about.
Yes. We do. Yeah, and there's so many things along the way. And so with that, it's like what women would say to me, once I get started, I'm good, but I never really want to initiate. And that's understandable. And so that's how we're designed. We're designed as secondary responders, really. So once we feel intimate connection, our oxytocin goes, and then we're like, oh, yes, okay, I'm into this. That's our natural physiologic response, and that dominates a primary response. Yes, we can have both, but really the secondary response dominates, and that's perfectly feminine. It's perfectly awesome. It's perfectly good for quality of life. And in my sexual CPR program that I'd love your listeners to turn into, they can listen to my free webinar called Help Doctor, My Sex Drive Has No Pulse. And I go into this and some other fun aspects in a lot of detail. But I think those are four key areas that really address the whole lifespan, but even in the 20s, there's one more, this fifth one that is emerging based on the science that I don't know how, well-versed we are in it or even how much we want to believe it, but there's reality coming through to this based on neuroscience. Y'all want to hear it?
Oh, yes. Yeah.
Any guess as to what it is?
No.
It has to do with our cell phones.
Oh.
Oh.
Is it? Well, it's either, I don't know. It's just a distraction, isn't it?
Well, that's one part, but the blue light emitted from our cell phone.
I was going to say the circadian rhythm and the blue light.
Yes. Exactly. And the blue light. So in Japan, reality is celibacy syndrome. All these young teenagers, 20s, 30s, not wanting to have sex and increasing rates of infertility. So it's called celibacy syndrome. We recognize that it's from blue light. So we must have a protective blue light blocker over our cell phone, over our electronics, really be conscientious of this, even if we're wearing, to get our natural sunlight exposure as well, through our retina, which is our solar panel. So not obstructed by sunglasses or eyeglasses, and especially not contact lenses. Wow. Whoa. Right? How do we live?
No kidding. Everyone's in bed with their cell phones at night. Come on now. Who actually hangs out with their partner in bed anymore?
Somehow we have to change it. So if for your listeners and for you ladies too, have you downloaded, there's a free app called Just Get Flux, Flux, justgetflux.com.
Okay.
And it will put a rose hue on your computer screen in the background. It's not for an iPhone app, or I don't think it's available for iPhone.
I think there are ones for iPhones, though. I've just been doing a lot of research around sleep lately, and I don't know what the names of them are, but I know that they exist.
Yes, and actually the new iPhone has something built in, but it's not strong enough, according to Dr. Jack Kruse, who's a world-renowned neurologist and really into this light energetic stuff for hormone balance and brain health. So, just get Flux. So that'll do a rose hue, but plus get the blue light blockers on the on your computer screens, on your iPhone screens, or gunners, those orange hued
glasses.
Yes,
I have the glasses. I've hardly ever used them, but I should probably pick up the habit again.
Yes, it does make a difference. Decreases eye strain, decreases your risk of macular degeneration.
Yeah, well, I feel like that's a massive problem for so many of us now, too. I feel like my eyesight has deteriorated significantly in the last 10 years of computer use.
Absolutely.
Oh, yes, totally.
So I love this because it removes some of, not the blue light stuff, that's good too. I've got to go and,
that's good stuff, too.
Action a few things there. But what you were talking about prior to that, and it relieves a lot of the pressure, which is part of that response, that stress response. It relieves a lot of the pressure in, women needing, or supposedly because of the media and in the movies, always being on and ready. And you're saying that, that's perfectly normal for a male or a man. But for us women, we kind of need that little gentle push to kind of get us going.
Yes.
Yeah, I love that.
Me too. I know. I think that so many of us are in a state of feeling like so much pressure from the external sources to be sexy and to be turned on all the time. And of course, there's the whole problem with porn and the fact that that brings all these crazy expectations. So it's really reassuring, I think, for women to hear what you're saying right now.
Oh my gosh, yeah. And seriously, to understand that porn is really detrimental. It's detrimental. We have to protect our minds. We tell that to our kids. We do so much to protect their minds. It's so important that we keep the reality as grounded and real and allow them to have a beautiful, inspiring imagination, right? So we do that for our children. We need to do it for ourselves. And I always say, reality is to an Arnold Schwarzenegger movie as porn is to sex. I mean, there's no reality comparison, right? I mean, it's not, and it can't be, but it is. It's addictive, and it's designed to be that way, and it's detrimental. There's nothing better than being purely present in a relationship, exploring each other, which you could do indefinitely and still discover things when you are totally present and with that person, fully with your own sexual voice, expressing what you like and what you don't like, and also learning from each other in a positive, kind, supportive, manner. There's nothing better. And porn puts a shadow over all of that.
Absolutely. I was listening to an interview the other day by the authors of a book called Girls and Sex. It's a relatively new book, and she was talking about porn and how it's shaping young women, or at least their perception of what sex should look like, and they all feel the pressure to be, turned on and sexy and acting out this role. And what the author was saying was that, well, a woman has to do that in porn movies because otherwise it would be a silent film, essentially. And it's so true. And it really struck me because nobody ever thinks of it that way.
Exactly.
moving on from the porn talk, how about talking about a little bit about vaginal dryness or discomfort during sex? I know we spoke about that a little bit, but how can we really address that? Because that, of course, is a really big issue for women, not only in perimenopause and menopause, but younger women as well, especially after coming off the birth control pill or postpartum.
Well, there's a couple things. One is natural lubricants such as coconut oil versus any of the other lubricants, etc., is just really nurturing the skin of the vulva, and very free. You can use, very low cost, right? A little bit of organic coconut oil can go a long way, especially on the tender skin of the vulva, the urethra, etc. So that makes a nice, healthy lubricant. It's also bacteriostatic and fungostatic, right? Will help fight bacteria and yeast from growing. So that's why I love coconut oil as a lubricant and also just as a vulvar moisturizer in general. Mm-hmm. But also our nutrition is so important, right? We have to support our adrenal glands, and with that, so our DHEA, our natural DHEA, our adrenal stress hormone, is well supported. I created a greens product called Mighty Maca Greens. It has 42 ingredients: maca, resveratrol, turmeric. I mean, everything you'd want in it is in it, and it's non-GMO. Gluten-free certified, dairy-free, etc. I've been using this now in my practice since I created it in 2009 with excellent results, and we have it around the world available through medical practitioners that recommend it to their patients, so it's super cool. And it's now available too online at mightymaca.com, and that's an amazing thing. And y'all can, your audience, if you'd like, give them the code CONNECT, and they can get $10 off their first order. So
awesome.
So that's, that helps support our adrenal glands. And for me, using all kinds of adrenal adaptogens, et cetera, in my functional medicine practice before I created this, and this is the thing that increased my DHEA threefold in 2 months. And I had been struggling with everything else for so long. It has vitamin C in it. I mean, it's really a good complex, and it will help your body fight inflammation as well as balance your hormones, so that helps with PMS symptoms, right? Mm-hmm. And that's kind of been essential, foundational addition for my clients and so many others as part of their nutritional regimen, just to add that. Or green smoothie in the morning, add a scoop of the Mighty Maca greens in it. And so anyway, we support our adrenal glands, and that's really going to help with our libido and our stress, because when we're continuing to deplete our stress hormones, we need to support that with additional nutrients, and really to get the inflammation and acidity out of our body so that we're more alkaline and in a natural, more homeostatic state. And so that's beneficial. Makes us feel better, look better, function better, think better, all those things that we want to do, and sleep better. So that's part of it. A third thing is that we use too, again, is a topical DHEA, and this is something I would prescribe in my practice for quite a number of years, with prescription testosterone or DHEA in a vaginal tablet or cream, and using that to quickly help restore the vaginal tissue. All we hear about in the literature is estrogen, right? Just use some vaginal estrogen. Yeah. But that only works on the mucosa. That doesn't work on the muscle, right? We know androgens work on the muscle. And so DHEA, which is over the counter as a sublingual, like for under the tongue, or as a pill, however, it's available all around. But if you have it for the vagina, it has to be prescription. So I got irritated with that rule, and I created a Vulva Cream with DHEA in it, some alpine plant stem cells, and some emu oil and coconut oil, made this into a beautiful combination cream with DHEA in it, and that's called Julva. So it's like for a young vulva, Julva, and it has rose essence in it, so it's like, I smell like roses.
Every girl's dream.
Exactly, right? It's got to smell good, be tasteless and odorless, right? So it's a topical vulva cream that's available next month, actually. We'll have it available.
Exciting. Amazing.
Yeah, and I'm excited about that because women all over are suffering. And if your doctor's not aware of it, and believe me, I've lectured far and wide on this topic, but if they're not comfortable prescribing it, and it's very, very safe, DHA topical is very, very safe, and a small dose goes a long way to restore that. And it's, again, it's a bioidentical. So that's really important to me. And that we make this accessible to women that are struggling. And it can just be temporarily, like postpartum, especially after, our pelvic floor is stretched out. And then we're stressed and sleepless from, postpartum pregnancy. And so just sometimes adding a little additional adrenal support, and why not put it where you're going to need it the most and preserve your vulva from getting incontinence as you walk down the grocery store aisles and you see rows and rows of incontinent pads and you think, oh, this is so preventable, right?
Yes.
Yeah. Or you're jumping around at the gym and you're like, oh yeah. Anyway,
exactly.
Something I can relate to.
Yes, it's like weight kegels.
Yeah, I think, what about, there's all these amazing solutions that are going to help people obviously change the environment of their vagina and make things, healthier. But there also comes a point where for some, I'm assuming with some people and some patients, there's that conversation about what's driving the stress. If it's not postpartum or it's not something that you can pinpoint, there's that ongoing life stress that people just aren't necessarily prepared to address and deal with. How do you have that conversation with your patients?
So let me understand the question. So the ongoing relationship stress or the...
Well, I just think that stress is such a big factor in this. Right. Am I right? And yes. And so many people aren't prepared to acknowledge that and address that. We love to treat a symptom with a pill, or we love to, quick fixes are what many of us are trained to think that that's the solution. But very often, if it's not a case of someone's postpartum or menopausal or perimenopausal, they are just stressed. How do you have that conversation with your patient? Because I think it's something that we can all relate to, but people aren't prepared so much to acknowledge that is the problem.
Absolutely right. And this is the reality. So you come in for your gynecologic exam, your pap smear, and your doctor's on the way out the door, and you're like, and doctor, I've decreased libido. My sexual desire is low. And you kind of been intimidated to even bring this up. Doctor's hand is on the doorknob saying, oh, well, you just had a baby. It'll get better, and leaves the exam room, right? Something to that effect. Or you're stressed, of course, and it leaves the exam room. Or, watch a romantic movie with your husband. That will help, and leaves the exam room, right? That's the reality of our medical practices, unfortunately. And that's why I created, honestly, sexual CPR, because I knew once I restored my own health, I recognized the stress effect on my relationship. And I had post-traumatic stress disorder from a very traumatic experience and loss, and I recognized that here all of a sudden, as I could get my physical body healthy, I couldn't reconnect on the emotional level. So I created sexual CPR for that reason, because I hate to see couples relationships disintegrate because physiologically we're disconnected. Right? We still love that person, but feel disconnected, feel like totally even aversion sometimes, but we're both good people. What's going on there? And there's this, I call it the stress, connect, disconnect phenomenon. I've written a blog on this too on my website, and have a quiz called the oxytocin quiz, or secret hormone quiz. And because our oxytocin hormone is our love, bonding, connection hormone. And when we are stressed, cortisol, it's like a seesaw. Cortisol goes up, oxytocin goes down. I mean, that's a very generalization, but it's pretty close to that anyway. Or we're under stress for a long time, and then cortisol's down and oxytocin's down, and that's equivalent to burnout. Why the job you love, no longer do you like it. Why the person you love, no longer do you like him. And that's this cortisol oxytocin disconnect. That's physiology driving behavior. And so when we learn that, when we see that that's a hormonal thing, I'm not feeling that bonding hormone, that physiologic bond that was so big part of our lives, the stress has really kind of created a wedge there. Just knowing that, making that, as far as like, knowledge is power, just knowing that helps us. But then what do we need to do? We need to do oxytocin increasing behaviors that help us get back into connection with our partner. So even hugging, caressing intimately, having a massage, just light touching our partner, even head rubs, if that's something you like, can increase oxytocin. Laughter can increase oxytocin. Getting out into nature, connecting, decreasing cortisol can increase oxytocin. And so if we focus on the behaviors and the actions that increase oxytocin, then and put able to like separate from all the drama in our life, right? To practice, to have a beautiful, mindful practice that keeps you very present to what you can control, and that is your responses, your emotions. It's the only thing we can control. We can't control anything else around us. And when we put ourselves in that framework, we're able to love better, love stronger, persevere more, and stay connected. And then, our relationships won't disintegrate, or that sense of needing to bond, or the lack of sense of needing to bond won't be there either. We'll have that natural ability to bond again. But when we realize that stress and the hormones of stress create that wedge, then we need to address that battle, not that the other person's bad, or I just must not love him anymore, right? That I just must not love him anymore. That's like, hey, how about the honeymoon, a vacation, reconnect, get some alone time, realize that you're both good-willed people, and how do you reconnect on that level and remove the stress factor? That's investing in our relationships is the number one investment we should be making in our lives.
And it kind of takes a backseat very, so often because we are so busy and we're stressed and there's children and whatever else. But we could keep on talking all day. I know we're running out of time. Before we say goodbye to each other, one more question that we had that we wanted to cover that I think a lot of women are really keen to learn about is, what about vaginal odor, especially after sex? What is that about? What does it mean, and what can we do to address it?
Yeah, absolutely. Great question. That's one of the very common questions in my gynecologic practice was exactly that. And the reason is sperm is alkaline and seminal fluid is alkaline and the vagina is acidic. And often the bacteria within the vagina, lactobacilli, we can have a natural overgrowth to that. But when the alkaline semen, seminal fluid, comes in the vagina, that creates an environment where that bacteria really thrives. So you may get a fishy odor after sex, and that's what's going on there. So, making sure you're on healthy probiotics, use coconut oil, which is a little bacteriostatic. Just those two things alone can help change that completely as well. So I think that makes a really big difference. And I always joke and I lecture to physicians all over the world, and I'll tell them, I said, we can tell the health of a whole individual just from the vagina. It's so true.
It's so good though, and that's so simple. I think it's really important for people to understand that is normal, because the lengths that some people will go to, I mean, obviously if there's an odor outside of that time and it's, it can indicate that there's something that you should look into, but especially after sex in that combination, and that, obviously like you explained, that is okay. Like, that's the way your body is, and there's nothing actually wrong with you.
Yes, there's nothing needing antibiotic, because if you come to us, we'll send you home with a prescription of an antibiotic, right?
Yeah.
Because you got to.
Yes.
Essentially, right? But what I would tell you is do it, I never say douching because that disturbs your flora, but you could use a probiotic vaginally. There are some good vaginal probiotics available, and but you could use your regular probiotic and use it vaginally, or just take it orally. It will help. But also, if it's troublesome, then that would be, a vinegar water douche. That would be the only time I would recommend douching. But otherwise, don't douche. The vagina naturally cleans itself, so that's fine.
So clever. We're so clever, our bodies. Dr. Anna, where can our listeners find you? I'm sure they'll want more.
My website, connect with me there. A lot of exciting stuff coming up over the next few months. So it's at Dr. Anna Cabeca, spelled DrAnnaCabeca.com, DrAnnaCabeca.com.
Fabulous. Well, thank you so much for your time today. It's been an absolute pleasure to listen to everything you've got to say. I could keep listening. I don't know about you, Nicole. I'm pretty sure you're feeling the same.
I'm enthralled. I just love all of this conversation. It's so good.
So great. Well, thank you again. And until next time, everybody, keep on enjoying being a woman.
Thank you so much, Dr. Anna.
Thank you.
All right. Bye-bye.
Bye-bye.
Bye.